Hi, I'm Rachel Arthur, and I'm just going to introduce you to a best friend of mine in clinical practice, which is our patient pathology manager. As the name suggests, it's going to help you manage that very unruly pathology that we get from patients, which often ends up pretty messy, pretty noisy, and it's hard to cut through the noise and actually get the key take-homes. With a little bit of data entry, the patient pathology manager helps you to get the clear take-homes as quickly as possible. Not only storing all of their results and sorting them, but also solving a lot of your questions about the why behind it. So here we have a patient's labs all collected side by side. This is a great first step. This is cumulative data, which is incredibly important to get on your patients. One of the big questions we always have is, yes, but who are we comparing ourselves to and all those results to, and is that really meaningful? The patient pathology manager compares your patients to two different, if you like, reference intervals. The one that we don't use is this one, which is the one you're commonly seeing on your patient's results. These are in-house determined reference intervals. So your private pathology company has taken the results of a small sample of people. You can imagine that comparing ourselves with other people that aren't very well doesn't create a great comparison. And for GGT, we end up with quite a wide reference range like this one here in orange for women. We don't include that first one. What we do include is the national consensus. This comes from the Royal College of Pathologists Australasia. You can see it's far more conservative and says, look, really, a GGT for a woman should be under 30. So this is what's called an external or published reference range. But we go one significant step further. We actually document almost all parameters, the consensus from international large studies that help to define healthy. That is, you can see here in the case of GGT, providing us with extremely different comparators or thresholds. So here you can see in this 50-year-old patient, her GGT levels, according to the pathology company, were more or less okay half the time and perhaps a little bit high on 2 occasions when we just use that in-house determined reference range. However, the pathology manager will get you to compare that to the RCPA and then go one step further and give you really what is optimal for her sex and age where appropriate. And we can see she is far from optimal, and this is clearly flagging a disease process. One of the other gems of using the patient pathology manager to store and sort and solve your patient's pathology problems and questions is that it helps you to find your patient's normal. So where do they normally sit within the reference interval? Patients don't tend to vary very much if their labs are collected under the right conditions. And when they do suddenly make a shift, like this diagram illustrates here, this, even when this new result remains within the expected reference interval that you've been provided with, still is probably the earliest indicator of a disease process underway, and certainly requires some thinking about the why. The intra-individual shift is incredibly easy to pick up when you have all your data side by side, and we can see all of these results are technically still within range, but this patient is shifting away from her normals in both hemoglobin, hematocrit, ferritin, and the other iron markers. When we piece them all together, we can readily explain the process behind that intra-individual shift. Research increasingly is getting more and more focused on not just individual results, but looking at the relationships between results for related parameters. Now, the patient pathology manager has included automatic calculations and again, provided you with what healthy really should look like for your patient for all of these relationships. But wait, there's a little bit more. So the patient pathology manager also has the smarts to flag when results have not been collected under optimal conditions, giving you that heads up to treat that particular result, let's say ferritin for that patient, with a little bit of suspicion because the patient, for example, wasn't fasting or was profoundly dehydrated or whatever it was. The manager comes with a training video, you'll be pleased to know, and you have the capacity to download this template as many times as you need for each and every patient that you want to manage their pathology. We have a terrible habit of improving this all the time, which means typically we update the template every year for you. And as a purchaser of this product, you will get those updates. And what you end up with is something fabulous like this that, as I said, sorts, stores, and really solves a lot of the questions that you might have had if you were just dealing with that mess that we saw at the beginning. So it is my best friend in practice. I hope it's going to be yours as well. And I look forward to hearing how you go.